Hello everyone, I'm Johanna Bertumenonato from Bridge Oz Migration Consultancy. Today, I am with Charmaine Marto, and we will discuss her story coming from Bicol, the Bicol region in the Philippines, to Christchurch in New Zealand, and then here in Melbourne, Australia. All right, so Charmaine, I have questions for you. So, paano ba nag-start? How did you have that idea that you're going out of the country? And is it New Zealand ba kaga? Alam mo yun, is the goal to go to New Zealand or to go to Australia?
Sir, it started po after our graduation po sa uni.
All right.
Yeah.
And what did you take up in the uni?
I took up tourism pero major in hospitality management.
All right.
Yes.
Layo ah. Okay.
Yes, po.
May chance pa kayo yung mga nasa hospitality pwede maging nurse. Okay.
Yes po. And then originally I wanted to study in Australia.
Okay.
Pero ang offer sa akin, parang sabi, just go to New Zealand. Parang mas okay daw, mas better opportunities.
Okay.
Then I said, okay, why not? So I went to New Zealand to study business management.
Is that a bachelor's degree or just a certificate diploma?
It was a diploma.
Okay.
Yeah, a diploma. And then, yeah, I studied there for a year. Then after that, was on working visa.
Oh, yes.
Yes.
So you were sponsored. Okay. All right. Working as a PCA?
I started working po in hotels.
Oh, yes.
It was in hotels, then restaurants.
Yeah.
Then eventually, one of because most of our friends there are like nurses.
Okay.
And then they said, "Oh, why not apply in the nursing home? Like,
Okay.
I'll work there in the kitchen." I said, "Oh, okay, sure." Then I started working there as a cook's assistant.
Okay.
Yeah. And then I saw how like the nurses and the PCAs work in a nursing home. Then I got more interested. I said,
Okay.
how about I might work as a PCA?
All right.
Yeah. So that yun po,
That
dun
was
na po
the start.
nag-start. Yeah, that was the start.
Okay.
Yeah.
So, yung work visa kasi, if I understand it, kasi iba sa New Zealand eh. You were sponsored in the hospitality, tama? Sa work visa mo. Tapos, naglumipat ka ng PCA. Okay.
Yes po.
Did you have to change the visa or not really?
Had to change the
You have to
because
change
I
it.
have to
Okay.
get a sponsorship
Another
from
sponsor
yes.
for that. Yes. Okay. So, okay, sa PCA ka, nag-PCA ka.
Yes po.
Nung nag-PCA ka, gaano katagal kang PCA din sa New Zealand?
I think for 3 years.
Okay.
Then parang around 2018 parang sabi ko parang I want more. Parang gusto ko pa mag-study pero I was thinking, should I study in New Zealand or move to another country or maybe should I go home or study medicine?
Okay.
So I was like thinking, ano ba? Tapos I was consulting my family kung ano bang gusto nila, kung ano bang mas okay. Tapos sabi ng friends ko na you're already here in New Zealand. Why do you have to go back to the Philippines?
Yes.
Tapos sabi nila, why not study nursing here? Tapos siguro yung mga June 2018, pumunta yung auntie ko from
Melbourne. Visited you?
Yeah, visited us.
Okay, yeah.
And then sabi niya, come to Australia with us. Then, because she's working as a nurse.
Oh,
Yeah,
yes,
she's a nurse here in Australia. Tapos sabi niya, come to Australia, then, mag-study ka nursing, ganyan. Tapos yun, parang sabi ko, sige, kasi parang Australia naman talaga is yung gusto ko talaga.
Yun naman talaga yung goal mo, even at the beginning.
At the beginning. Yeah. Sabi ko, sure, parang ito na, doon na nag-start. So, nung I think mga June June 2018, nag-start na akong maghanap ng agents para makahelp sa akin makapunta dito sa Australia. Yes.
So, which started as a student visa muna.
Yeah, student visa.
So, and then you took up nursing sa Deakin University.
Yes, for 3 years.
For 3 years. How was it like, the experience in studying in Deakin?
Studying in Deakin is like very different. Yung very different compared to yung nakasanayan natin sa Philippines.
Oh, yes.
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 It's very different
Yeah.
because for like if we're gonna have to study here, just like can choose in a week, you can choose like for 1 day or 2 days, depends on your availability. It depends din sa available na classes on that days that
Hindi full-time,
Hindi
diba?
full-time.
I mean, by definition, full-time yon sa
Oo.
international student. But full-time definition is 2 to 3 days.
Yes,
Yun lang,
yes.
per week.
So, and then after that, you have to study on your own as well. It's called self-directed learning.
Oh, yes.
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 So, we go to the class and then for us in nursing, do some simulation or do some case studies together as a group. Tapos, we go to the simulation labs to do the hurdles, yung mga clinical skills.
Yes.
Then, yeah.
How do you differentiate naman yung studying in Australia versus studying in New Zealand? How was the experience? Is it similar? Is it different?
It's kind of similar.
Yeah.
Similar in New Zealand and Australia.
Yeah, same standards.
Same
It's always
standards.
writing.
Yes.
Yeah.
Always essays.
Yes,
Yeah.
assessments.
Yes,
Okay.
always assessment.
All right. So, you've studied for 3 years and then you finished it. So, when you finished in Deakin, was it easy to find a job? That's when you got your registration. Yeah, your RN registration after.
For me, it was because before graduating from Deakin University, I was already working in one of the largest public hospitals here in Melbourne.
Ah, yes.
So yes. So I
Okay.
started working there as a Ruson.
Okay.
They call it as a Ruson, like an assistant.
What is that?
It's like an assistant in nursing.
Oh,
but
okay,
yeah,
okay.
it's just a preparation for those who are studying bachelor in nursing.
Oh, okay.
Yes.
Okay.
To get a feel in the hospital setting.
Okay. I think that's the benefit of getting a 3-year course, right?
Yes.
Because most nurses from the Philippines, they would take the 1-year course. But then again, they're already nurses, that's why. But with you, because you're coming from PCA, you really have to take the 3 years.
Yes.
But there are benefits to it. Kasi nga, longer training, longer exposure, longer work experience, and then it's easier to find a job na after.
Yes. Yeah. That's correct.
So, how do you compare naman yung work? Kasi although it's different industry, right?
Yes.
Hospitality and then medical field, Philippines versus Australia or New Zealand. How can you compare the work ethics of people? Or the employers themselves or the employment law? How can you differentiate?
I think it's probably almost the same, I guess. But like here in Australia, they have this the work-life balance.
Oh, yeah.
Yeah, which is I like.
Yes.
Yes.
Kasi they're very protective of the employees and we have, fair work. Everything's there, it's enlisted.
Yes.
And they have to follow. But in saying that, some might not still follow, right?
Yes.
Yeah, but at least you know that you are protected. Because in the Philippines, I've never known those stuff eh.
Yeah, me too.
Were we aware?
No.
Yeah.
But here, yeah, they really encourage you to have the work-life balance here. Yeah, which is nice.
Yes,
Yeah.
which is very important. Okay, so ito na, you're working, and then, kamusta naman yung progression sa work? Like, is it easy to get promoted? How do you get promoted? Madali ba?
I guess it is, but I think for you to be promoted, I think you have to study like masters.
Okay, for the nurses,
for
you
the
have to have
nurses,
masters.
yeah.
Okay.
Like if you wanted to be like a clinical nurse specialist, I think
Okay.
they're looking for someone who taken up postgraduate degree or masters.
Okay.
Yeah.
And usually, correct me if I'm wrong, hospitals or aged care facilities, they have budget for training.
Yes, they do.
Yeah, which you can use as well from the hospital. Yeah.
Yes. Like for us, they have this program like in the hospitals that it's called transition in specialty program.
Oh, yes,
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 yes.
yes.
So if you wanted to work in emergency, ICU, peri-op setting, the government will fund.
Oh, that's
Yeah,
really good.
yeah.
Yeah.
They will the hospitals will help the
Yeah, because
aspirants
you're
to
in a
this.
big
Yes,
hospital. That's
yes.
why it's easy to, you can even choose which specialty.
Yes, that's correct.
Okay. All right. So working and stuff, and then so how do you? Ano naman ang fun side? Siyempre, work is work, right?
Yes.
So what do you do outside work?
Travel.
As in within Victoria
Within
lang?
Victoria,
Yeah.
or sometimes po, if we have like 1 week or 2 weeks off, then go somewhere else.
In interstate.
Interstate,
Yeah,
yes.
yeah.
Go somewhere else or regional. And then, yeah.
Kasi Australia is very big.
Yes.
Right? So we can drive many days. You're still in Australia.
Yes.
So there's just so much to unravel. There was so much to visit.
Yeah, so much to do as well.
Kasi nga may work-life balance ka. So you should also have time to, have fun. Or have time for yourself. Okay, so working in New Zealand, working in Australia, or studying in both countries, what were the challenges that you faced and how you resolved them?
I think here the challenge was to land a job first. Yeah, it was kind of challenging because they were looking for someone who has already an Australian experience.
Yes.
Yeah.
Australian experience and maybe a certificate.
Certificate.
Ano bang ina-applyan mo? PCA?
PCA. They were
Yeah.
asking for certificate 3.
3. Individual support.
Yes, but I have a certificate from New Zealand.
Yes.
But then they said I have to parang
Ko-convert pa.
convert pa.
So they would not just... That's very interesting.
Yeah.
Kasi New Zealand di ba?
Yeah.
Dapat halos pareho lang eh.
Yes.
So hindi pa rin nila kinonsider yung certificate mo from New
Yeah,
Zealand.
they told me to I have to convert it. But
okay. Yeah.
I wasn't too sure where
yes.
which they have to convert it to.
Oo. There's this thing called yung RPL, Recognition of Prior Learning, with your work experience. Pwede yun. Maybe through that. Yeah. And I guess, kasi mahigpit talaga ang medical field eh.
Yes.
Diba? Na-audit and stuff like that. That's why maybe they are like that.
Yeah.
So sabi mo, it was hard to get a job. And interestingly, you already have the work experience. Diba? From New Zealand pa. E paano pa yung iba ni walang experience sa other countries except for the Philippines. So, nung mga time na yon, gaano katagal from the time na naghahanap ka hanggang nakahanap ka ng work?
I think it took months po before I landed a job in nursing home.
Okay. And how long did you stay in the nursing home? Habang nag-aaral ka? As in the whole 3 years? Hindi naman.
I think the whole 3 years.
Yes, yes. Kasi assistant in nursing din, ganon.
Yes. So, I was working po in a nursing home. Then I was working in the public hospital. Because during COVID, they require us to that we can work full time.
Yes.
So sabi ko, sige, I'll work full time while study, because the classes were online.
Okay.
Online that
which
time.
is good. Yeah.
Which is good.
You were really blessed kasi
Yes po.
medical field mayroon talagang trabaho.
Yes po.
Pero yung mga chefs kong kliyente, it's really hard. Yung
it
mga
was hard
di ba?
po.
Oo, from the hospitality kasi sarado talaga sila. Pero kung may mga takeaway and stuff yan, meron naman trabaho. So about the pay naman. So you worked in New Zealand and Australia. What's the difference in pay?
Completely different. Mas malaki po dito.
Mas malaki
Yeah, mas
talaga.
malaki
Pero
dito.
yung laki ba, 50% mas malaki, 30%? Ano yung jump?
I think back in 2018, dun po sa nursing home na pinag-workan ko,
Mm-mm.
ang for nurses po,
Yeah.
I think ang sweldo nila is 26, 25, if
Yeah.
I'm not
Per
mistaken.
hour.
Per
Yes,
hour.
yes. Pero nurse na yan.
Per nurse
Oo.
na. Pero dito,
Mm-mm.
yung rate ng nurses
Mm-mm.
ay rate ng PCA.
Ah, okay. Ulit. So, magkakanong nurses? Ganyan.
Nurses po,
Dito?
dito, depends on the experience. Pero
Mm-mm.
for yung mga newly graduates, sa public hospital ay 34.
34, yes. And so, pinakamababa na yun.
Mm-mm.
Yeah. Then that's really good.
Yeah.
Hindi, teka lang. Kasi sabi mo 25, 26 sa PC. Hindi, sorry. Nurse yun.
Oo.
Aged care facility.
Mm-mm.
Tapos sa hospital na public hospital dito, mga 34.
Mm-mm.
Magkakano ba yung nurse dito sa aged care facility? Parang mas mataas yata sila sa hospital.
Mas mataas
Oo.
sila sa hospital.
Totoo,
Lalo
mas
na
mataas,
kung
no?
yung grade 5, may mga grades sila.
Okay, oo. Isn't it the reason why mas madali, mas mataas yung sweldo sa aged care? Kasi mas marami daw trabaho. Tama ba? O pareho lang ng trabaho?
Mas madami. Kasi, I've also worked po sa isang nursing home dito.
Mhm.
Nag-try ako as casual.
Yes.
Parang hati po kami ng EN, ako, and then EN po. 1:30 residents.
Oh, wow.
Yeah.
That's a lot. Liliguan mo pa yun, di ba? Sa shower mo siya and stuff.
Ay,
O,
naman
PCA
po,
na
PCA
yun.
naman po yun.
That's good. Okay,
Pero
okay.
medications, then if
Ah.
something happens po, like if a patient falls, you have to attend them.
Yes.
Yeah, lots of responsibilities din po.
Kung
sa
1:30 sa aged care facility, ano ba yung ratio sa hospital?
Public hospital po is 1:4.
Wow.
Yeah, yes po.
Ang laki ng difference.
1:4.
4 versus 30 eh.
Some
Oo.
other hospitals po ay 1:3.
Oh, wow.
1-3 patients. Pero sa private hospital, I think 1-5, sometimes 1-6.
Thus the pay difference. Yeah? Parang kinocompensate nila.
I
Yung
think so.
mga sa aged care na kasi mas maraming trabaho, then mas malaki ng konti yung sweldo nila. Pero given a choice, kasi nasa ospital ka naman talaga ngayon eh. Mas gusto mo ba sa ospital o sa aged care?
Mas prefer ko po yung hospital. Kasi mas marami po akong natututunan in terms of clinical skills since kakastart ko pa lang.
Oo nga,
So,
kasi
yeah.
marami kang pwedeng puntahan na
Marami
different
akong
fields.
puntahan na
Yes.
different fields.
Unlike with aged care, yun na yun. Di ba? Oo.
Although maganda rin po mag-work sa aged care.
Okay.
It was fulfilling po, rewarding din po.
Oo nga. Oo. Alright. So it's like, we discussed the different, yung mga specialties ng mga nurse, right? Kasi, now I can understand, some clients would be, hindi, I will never work at aged care. May ganun eh. Because, hindi, hospital talaga ako sa Philippines eh. Yun talaga yung gusto ko. Oo. But suffering kasi talaga yung aged care namin. Di natin dito, so kailangan talaga ng tao. So, in terms of, yun nga, yung promotion and stuff like that, marami ba na mga PCA na nag-aaral din ng nursing na mabilis lang sila na-promote sa maging nurse? Parang automatically ba kapag gumraduate ka, you get the certificate, PCA ka dati, would the employer usually give you the role as a nurse right away?
Yes po. It usually happens po like if a PCA po finishes her degree in a bachelor's po or diploma, then they can apply po ulit dun sa same employer po na if they wanted to
Become
continue
a nurse.
working there as a nurse.
Pero
then
in terms of number of people, right? Siyempre, I would imagine sa isang aged care, mas maraming PCA, tama?
Yes po.
Tapos mas konti nurse. O pareho lang?
Parang
Or depende sa
I think
structure na lang.
depende po
Oo,
sa nursing home.
Oo. Kasi sometimes I also hear from clients na hindi ako offeran doon as a nurse eh. I have to move. Baka kasi may reserved na positions
Opo.
for nurses. Okay. So, ano naman ang payo mo sa mga tao na gusto mag-migrate sa Australia?
Okay.
Anong mga tips mo sa kanila?
Number one tip is do a research.
Ah,
Do a research po. And wag yung padalos-dalos. Hindi lang yung dahil sa sabi ni ganito, sabi ni ganyan, na kumbaga parang do your own research din. And also, if you have any questions, you consult a registered migration agent. Then they can answer all your queries. And then also, ano pa? Be financially ready as
Oo,
well.
tama rin yan. Oo. Tama yung research kasi sometimes, I don't know if it's just Filipino culture or other cultures too, na kapag nagtiwala, tiwala na talaga lahat. Lahat na. I mean, it's like, that's why, bahala ka na sa akin. It's good if you find an advisor who would really help you. But if you find an advisor who's there to just take your money, then it's really dangerous. So, research, nandyan naman yung available sources. And when you get advice, good advisors usually give you the link to the proper source, the
Yes.
law. So, kung magpapa-advise kayo, registered migration agent or immigration lawyer, always ask, saan galing yung advice mo? Baka pwedeng makita. Right? I mean, it's not like you're undermining them, but, you have the right to ask.
Yes.
Importante yun eh. Kasi wag mong tanggalin na, hindi na ako part ng process, alam nyo na yan eh. Yes, we are the experts, pero we also like it when you research kasi you can question, di ba? You can always ask questions. What we don't like though, yung sabi niya nga, yung bulong-bulong. Right? So, you will have many experts. Di ba? Na, hindi kasi yung auntie ko, ganyan. Yung classmate ko, it's hard kasi it's doubling our jobs. Kasi nasabi ko na namin yung advice based on the legislation and then marami talaga manggugulo eh. You really have to choose sino ba yung noise, sino ba yung tama na pakinggan. And yung sabi mo naman, financially ready. So, money begets money eh. It's not saying that, kailangan, it's not like we'd like to get your money, but kahit ikaw lang mag-process mag-isa, kailangan ng pera. So, studying in Australia is very expensive, right?
Yes,
So, living cost mo pa. So, it's not something that, hindi, I would just want to try. Hindi, I'll find work there. So, be very, careful of people who would present to you that, libre itong service ko and I'll enroll you, magkakatrabaho ka doon. Mapi-PR ka doon. So, those promises, you really have to validate kasi marami kasing naloko na ganun. Right? Especially kung wala kang kamag-anak and umaasa ka na, kita mo, ilang buwan. New Zealand pa siya galing, Ilang buwan, wala siyang trabaho, pero may auntie siya dito. So, just to wrap it up, ang advice sa atin ni Charmaine is, yun mag-research ka. So, do your own research. Don't rely on people. If you will rely on people, make sure they are registered migration agents or immigration lawyers. But even if you try to get the source. And secondly is, ano yung second? Sorry. Ano yung second?
Financially ready.
Ayun.
Yeah.
And the second advice is, if you're looking at moving to Australia, kailangan talaga ng pera. You have to be financially ready. Oo, kasi sometimes I hear, mahal daw magpa-certify sa Philippines. Right?
Yeah.
But we don't need that for the visa here, right? Kasi nga, scan color copy is okay. But then, if you say that, pagpa-certify pa lang, wala ka ng pangbayad eh. Paano pa yung pang-visa fee? Paano ba yung tuition fee? Paano? Yeah. So, and I guess I'll just add, hindi lahat ng way to Australia is only for student visa.
Yeah.
Okay?
That's true.
So, You can come to Australia. We've done it many times sa mga kliyente. Galing sa Pilipinas o galing pa ibang bansa, diretso dito pagdating permanent resident. You have all the benefits. Pati pag-aral ng anak mo libre hanggang 18 sila. So subsidized pagka nag-college na sila or university. So please don't close your minds na aral lang talaga ang pwede sa Australia. Yes, sometimes kailangan mag-aral kasi wala ka dun sa skills list namin, hindi ka mapa-permanent resident. But when people tell you na that's the only way to come to Australia, always question that. Question who you are talking to. Ask, well, do you even have the right to advise me on visa matters? Kasi sa Australia, illegal mag-advise ng visa kung hindi ka registered migration agent or migration lawyer. Alright? So, ito lang yung mga tips na, we're trying to, because I'm very passionate about it. I don't really mind whether you get the service from me or not. Pero gusto ko sana yung tama.
That's right.
Oo, yun talaga kasi. So, ayan. So, we have a successful client here. Diba? From Bicol, New Zealand, Australia, a registered nurse here. Thank you so much,
you.
Charmaine. Thank you. If you want a thorough discussion of your visa options in Australia, book in a consultation with our registered migration agents at www.bridgeaus.com.au.